Ever wonder what goes on in your brain after you fall asleep? You may be asleep, but your brain is not. In fact, it is very much awake. I chose to do my Genius Hour project on subconscious behavior to find out what really goes on in your brain after you fall asleep, and also to do a little more research on the sleep disorder insomnia. These are some of the questions that drove my research and that I will be answering in this presentation. Once you become unconscious, your brain goes through two different types of sleep, called REM sleep and non-REM sleep. REM sleep, or rapid eye movement sleep, begins about 90 minutes after falling asleep and comes in a series of periods. The first period lasts about 10 minutes, and each preceding period is a little longer than the last. As you can see from this diagram, the brain is very active during this mode, for this is when you dream. During REM sleep, your heart rate and your breathing quickens, and your brain, as you could see before, is more active, which produces those intense dreams, which you may or may not remember once you wake up. In babies, REM sleep accounts for about 50% of their normal sleep cycle, while for adults, it's only about 20%. Non-REM sleep is what occurs immediately after falling asleep, and it comes in phases of 3, which are about 5 to 15 minutes each. First phase, or stage, is referred to as, you guessed it, stage 1. This is when the eyes are closed, but it's very easy to wake from, as it is the lightest of the 3 stages. This will probably be hard to believe, but the next stage is stage 2. This is still light sleep, but the heart rate and body temperature both drop. The third and final stage is stage 3. This is the deepest of the sleep stages, and when you are woken up from this sleep, you are very disoriented. In these deep stages, the body regrows and repairs tissues, builds bone and muscle, and strengthens its immune system. Also, as people age, they get less deep sleep, and their sleep spans become much shorter, but they still need as much sleep as when they were younger. Another topic that affects subconscious behavior is a sleep disorder that affects over 1 million people each night, known as insomnia. Insomnia is a sleep disorder, and it is characterized by difficulty falling and/or staying asleep, which can be very detrimental to health. Symptoms of insomnia include sleepiness during the day, general tiredness, irritability, and problems with concentration or memory. There are 2 types of insomnia. Primary insomnia includes sleep problems that are not directly associated with any other health condition or problem. Secondary insomnia is when a sleep problem is because of a health condition like asthma, depression, arthritis, cancer, or heartburn, pain, medication they are taking, or a substance that they are using like alcohol. Insomnia can also be broken down into acute and chronic insomnia. Acute insomnia is short-term and can last from one night to a few weeks. Causes of acute insomnia could include significant life stress, such as a job loss or change, death of a loved one, divorce or moving, illness, emotional or physical discomfort, environmental factors like noise, light, or extreme temperatures that interfere with sleep, some medications that could be used to treat colds, allergies, depression, high blood pressure, and asthma, or interferences in normal sleep schedules, such as jet lag or switching from a day to a night shift. Chronic insomnia is long-term, and it occurs at least 3 nights a week for a month or possibly longer. Causes of chronic insomnia are depression, anxiety, chronic stress, or pain or discomfort at night. This concludes my Genius Hour project. Thank you all for your attention.